Good afternoon. Welcome to day 313 at the EMA office, where we bring you the latest in the numbers. Joined here with Chairman Mark Kern today, and today Assistant Director of the EMA, Brian Whitaker. Brian, and you have the numbers.
I do. So for St. Clair County, we have tested 239,199, which is an increase of 1,110 since yesterday. Positive test results were at 24,770, which is an increase of 152 since yesterday. Those are males and females under the age of 1 up into their 80s. That brings our daily county positivity to 13.7%. For negative tests, we have had 214,429. We are happy to report there are no new deaths today in St. Clair County, so that total remains at 383. For those that have completed their IDPH required 10-day isolation period, we are at 22,767. For state totals, they've tested 14,984,649. Of those, there have been 1,081,354 positive test results, which is an increase of 4,822 since yesterday. So the state did unfortunately announce 107 new deaths, bringing the statewide death total from COVID-19 to 18,398. For hospitalization numbers in St. Clair County, we have 95 COVID-19 related patients, of which 10 of them are on ventilators. For Region 4, there are 174 COVID-19 related patients, of which 17 are on ventilaters. For our congregate living facilities and outbreak status, we will only announce the changes, and as a reminder, these are cumulative numbers. Brea of Belleville is at 87 cases and 8 deaths. That's an increase of 1 case. Cambridge House of Swansea is at 26 cases and 0 deaths. That's an increase of 1 case. Cedar Trails in Freeburg is at 31 cases and 1 death. That is an increase of 2 cases. Freeburg Care Center is at 136 cases and 10 deaths. That is an increase of 1 case. And finally, Sycamore Village of Swansea is at 31 cases and 1 death, and that is an increase of 2 cases. I'll now turn it over to Chairman Kern for his update.
Great, thanks, Brian. So we'll move into the zip code report. In 62201, we're up 4 to 524 COVID positives. 62203, we add 4 to 547. 62204 goes up 1 to 356. 62205 up 5 to 567. 62206 up 4 to 1125. 62207 up 2 to 521. 62208 up 11 to 1392. 62220 reaches 1,700 today with an increase of 11. 62221 goes up 11 to 2,370. 62223 up 3 to 1,474. 62225 up 1 to 125. 62226 up 24 to 2,715. And 62232 is up 4 to 787. 62239 up 7 today to 400. 62240 up 4 to 133. 62243 up 1 to 644. 62254 up 2 to 700. 62255 up 1 to 65. 62257 up 8 to 286. 62258 up 3 to 886. 62260 up 7 to 654. 62264 up 4 to 307. 62269 up 15 to 2,789. And 62282 up 1 to 53. As Brian said, an increase of 152 new positives today, paired with 1,110 people tested, makes our county positivity go up today to 13.7%. And that's the first time we've seen an uptick in positivity for at least 8 or 9 days. So let's not let that be a trend. Let's remember we got to keep getting tested. Let's keep doing all the things we need to do, wash our hands, watch social distancing, wear our masks, stay out of crowds. This virus is getting more contagious all the time, so let's be aware of these numbers. The good news is with the numbers is that we entered a green day today, according to the state, which allows us to open up certain things. So while we're not quite yet to opening bars and restaurants yet, which is going to require being below 8%, as you're going to hear, our numbers are better. So we're headed towards that if we can maintain lower numbers. We didn't do it today, but we need to do it. We need to get below those numbers. So let's keep that positivity low. So rolling average then today we see is up to 9.6%, which is up from 9.3. Not a good thing for the county, but regional positivity went down today, which is a positive, and it goes down to 8.1%. As I said, we need to get below that 8% level if we're going to get open to 25% capacity for our bars and restaurants. Bond County in the regional positivity comes in at 2.6% today. Clinton County, 14.2%. Madison, 13%. Monroe is 5.3%. Randolph, 8.4%. St. Clair County, 13.6%. And Washington County, 13.5%. So we did have good news today. It's allows a few things to open up, Herb. Gambling, I think maybe theaters, those larger venues, but we're still not to the restaurants yet or the bars. That comes with the next level, right?
Well, on that level, we've got to keep our foot on the gas and keep these numbers going down. We're right at the edge there, and we're hoping in the next couple of days we can hit that benchmark that we have to. And so please, Team St. Clair, let's don't let up on it now, because we are so close to being able to get back to a little bit of normal that we want to make. And there's a lot going on with, as the chairman said, we've got to continue to get tested, because as you can see, the amount of zip code throughout the county today that had increases, that the virus is still out there. It's not going away. The vaccine project is gearing up. 330 West Main was busy today. We checked with the health department several different times. They're still working on that 1A category. We talked about yesterday, the mass vaccination site going to be going at the fairgrounds. That's coming along, a lot of logistics to get that up and ready to go, but we're bound and determined to get it done. So
the state's been a great partner, and as we always say, our hospitals throughout, they've been a part of Team St. Clair. They've been on this live feed with us. They're really arm in arm with all four of our hospitals. We've really been fortunate that we have them to help us in this community. A lot of the vaccinations right now are actually occurring at the hospitals. They've taken on a big part of the duties of getting 1A vaccinated, and we certainly appreciate that, and we really honor them, and we're glad that they're our partner.
well, and you made that clear today when you were being interviewed by the local Channel 5 when they were covering the story on the vaccines in the county. It's a team effort. There's just not one individual or one group. It's all members of Team St. Clair. Speaking of that, I want to give a shout out to one of our Team St. Clair members, Chief Allen, is back on here with us. Hope you're feeling better, Chief, and it's good to see you back on following the briefings here every day, because we try to bring the up-to-date information, and we're going to continue to do that. And that's what we're here for. That 8.1 down from 8.8, that's the number that I watch daily, because that's what's going to get us back below, to get the bars and restaurants to at least to the next tier, to where we can get our businesses back open to some.
And those that serve food.
And so they have to serve food, yes.
Yeah, the bars do.
So please keep sharing the word. We're still in the fight. We'll be hearing more from the health department on the vaccines when we get more in. And if you haven't signed up for that interest form on our page or on the health department or on the county website, that's the best way to do, because once you sign up on that, once we get the vaccine in the county, you'll receive a notification to go on and sign up for your appointment. And that's going to be the quickest and easiest way to get that done. So if you know somebody who hasn't signed up, taking advantage of that, it takes 2-3 minutes to fill that form up. with the basic information. Some things you have to have an email address, a phone number, to where we can make sure we get that information out to you. We're getting a lot of information from people about when they can get their vaccine, and we'd love to be able to tell you tomorrow, but we have to have the product here in the county in order to be able to do that. But we're getting there, so please hang in there with us as you have for 313 days. We'll be back with Daisy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow for day 314. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.